Good afternoon, everyone. I am Deep Silwal, student ID 651560. Today, through this presentation, I will be discussing about the research that I had conducted to find four articles for my clinical question on diabetes type 2 management strategy. I demonstrate my ability to present the evidence to answer the PICO question that I had presented in my previous assessment by using current-based research evidence that will be appropriate in professional setting. Through this presentation, I'll also be recommending for future research to further enhance and promote evidence-informed practice. Type 2 diabetes is a chronic condition with significant implications for patient health outcomes. Lifestyle modification, including exercise and diet, are fundamental components of type 2 diabetes management. Understanding the effectiveness of these interventions compared to routine medication is crucial for optimizing patient care and outcomes. For the clinical question, the effectiveness of exercise and diet compared to routine medication in improving blood glucose levels in adults with type 2 diabetes mellitus is justified within the framework of evidence-informed practice. Tried. Firstly, identifying the clinical issue of managing type 2 diabetes mellitus aligned with the principle of recognizing areas where evidence-based knowledge can enhance patient care. The focus on visual improvement through lifestyle modification versus medication reflects a critical aspect of diabetes management, acknowledging the significance of patient outcomes and quality of life. The clinical question was formulated by using the PICO framework that ensures clarity and specificity in targeted literature search and evidence appraisal. By selecting adults with type 2 diabetes mellitus as the population and comparing exercise and diet to routine medication to improve PGL, the question addresses a significant issue in diabetes care. This approach underscores the importance of developing intervention to individual patient needs and preferences, highlighting the patient-centered aspect of evidence-informed practice. By utilizing databases like Medline and Sinhal Complete to search for peer-reviewed articles published within a specific time frame and geographic context enhances the relevance and reliability of evidence gathered, aligned with the principle of acquiring the best available evidence. Integrating this evidence with clinical expertise and patient preferences as emphasized in the evidence-informed practice triad. This ensures that the selected articles are relevant for making informed decisions for enhancing patient outcome in type 2 diabetes management. Based on the evidence-informed practice principle, these are the four articles that were selected. The evidence hierarchy is a structured framework used in evidence-informed practice to select the best available evidence for addressing clinical questions. It prioritizes high levels of evidence such as well-conducted systematic reviews, but acknowledges that different research methodologies have varying strength and weakness depending on the type of question being addressed. Randomized controlled trials are ideal for intervention question cohort. Longitudinal design may offer better insight into understanding intervention over time. Therefore, the hierarchy is adaptable, recognizing that each study type has its advantages and limitations. The first article is a cross-sectional study which provides valuable insight into association, but they have limitation in establishing causality. It explores predictors of adherence to diabetic self-care. The second article is qualitative research, which can provide in-depth understanding and explores dietary behavior change post-diabetic diagnosis. The third article is a randomized control trial, which provides strong evidence for cause and effect. This study evaluates the effects of health literacy and screening on reducing unhealthy snacking. The fourth article is a clinical trial, which provides valuable evidence for intervention effectiveness. This study evaluates intensive lifestyle intervention for type 2 diabetes mellitus remission but focuses on primary care setting and remission. All four articles do not directly compare exercise and diet to routine medication. The article by Dekvar 2020 is selected for evaluation for this presentation. For question 1. According to this study, 72% of diabetes do not exercise regularly. The study fails to improve discuss whether diet and exercise are more effective than regular medication in improving blood glucose level in adults. However, the study suggests that providing patients with awareness and regular diabetes education can increase their adherence to diabetes self-care practices, self-monitoring blood glucose, and physical exercise. Question 2. The study included 207 patients with type 2 diabetes out of total 217, with a 95% response rate. Question 3. The exposure was accurately measured to minimize bias. The study utilized validated tools such as Summary of Diabetes Self-Care Activities Scale and a structured questionnaire completed through face-to-face interviews to ensure standardized data collection. By using Summary of Diabetes Self-Care Activities and a structured questionnaire completed through face-to-face interviews, adherence to diabetes self-care practices was found by ensuring consistency and reliability among 207 study participation. Question 5. During the study, self-care practice of type 2 diabetes mellitus was evaluated among 5 domains: healthy diet, physical activity, food care, and medication. There was no comparison between these domains considered in the study relevant to the research topic for accurate assessment. It is unclear from the finding if the study considered confounding factors in the analysis. Question 6. The study was carried out at a single health facility and included participation with type 2 diabetes. We cannot say if the follow-up of subjects was complete enough or long enough because the study does not provide information on follow-up duration or whether the lost subject would differ in outcomes. Without this information, we can't determine if the follow-up was adequate to capture the effect and outcomes accurately. Question 7. The study included 207 patients with type 2 diabetes, with approximately half adhering to self-care practices. Many patients were not engaged in self-care, blood glucose monitoring, or physical activities. It shows that diabetic patients require more education to increase their adherence. Question 8. It is difficult to determine the study accuracy. The findings provide a precise estimate of adherence rate among type 2 diabetes patients, indicating a degree of certainty. However, additional research may be required to confirm the finding and examine variability between missing population of conditions. Question 9. As discussed above, 10 of the patients who were suffering from type 2 diabetes mellitus were not involved in the study as they were suffering from psychiatric problem or mentally unstable or critically sick. This will affect result accuracy. Missed patient conditions could influence finding. This exclusion shows that results could not be generalized to all type 2 diabetes patients. Question 10. The results can still be applied to the population with type 2 diabetes who have access to similar healthcare environment. Different factors like differences in culture, access to healthcare, and socioeconomic status can all have an impact on applicability. Further research into these issues is required to ensure relevance to the local population. Question 11. The given study does not provide information about other available evidence or studies to compare with the results of the study. Without such comparison or any hints available in the study, it is difficult to determine if the study will fit with other available evidence. Question 12. No, the implication of this study for practice cannot be evaluated only through a single observation study. Recommendations for improvements in clinical practice or health policy must be supported by many studies or other forms of evidence. The study fails to discuss whether diet and exercise are more effective than regular medication in improving blood glucose level in adults. The finding for this study mentioned that 72% of diabetes patients do not exercise regularly. However, the study suggests that providing patients with awareness and regular diabetes education can increase their adherence to diabetes self-care practices, self-monitoring blood glucose, and physical exercise. Recommendation for practice based on ethical principle of beneficence and non-maleficence is doing good and avoiding harm by prioritizing patient education and support to improve adherence to self-care practices among adults with type 2 diabetes mellitus. These include promoting regular exercise, healthy dietary habits, and proper medication adherence. Healthcare professionals should ensure that interventions are developed to individual patient needs, preferences, and cultural backgrounds to maximize effectiveness while minimizing potential risks or adverse effects. Regular monitoring and follow-up are essential to track progress and address any emerging concern promptly. Future research should conduct randomized controlled trials comparing these interventions and assess their impact on blood glucose levels to provide clearer guidance for clinical practice. Incorporating patient perspective and considering cultural factors in intervention design can enhance effectiveness and adherence.